Good morning. I really appreciate everyone participating this morning. My name is Jimmy Screen. I'm with Volkert, headquartered here in Mobile. And I'd like to get started this morning and introduce our team, which includes Horn, as well as Thompson Engineering. Our team was hired in early August to provide program management and administrative services for the management and implementation of the state and local fiscal recovery funds from the American Rescue Plan Act, of which Mobile County received an $80 million allocation. I'm pleased to have this morning Commissioner Ludgood, President of Mobile County Commission, who is joining us and to kick us off this morning. Commissioner.
Okay, now that I'm unmuted, you can hear me say good morning. And I just want to thank all of you who decided to participate with us this morning for this webinar about how to participate in the county's American Rescue Plan. You know, I came onto the commission in 2007, but I'd been working in the community long before that, and I would always see, we would see needs that were out there, and typically the resources to meet those needs were just simply not there. Everyone recognized them. We knew it. I think we did the best we could. We put a little dab here and a little dab there. But what we have before us now is what I call really a once in a generation opportunity to address those chronic needs that we've seen in our community, for which the resources were simply not available. And so we're dependent on those of you who are on this call and others like you to bring to us in the proposal as part of this process, the solutions that we've been looking for some of these problems. We know that you're out there, you know what they are, you're out there in the trenches doing the very best you can, trying to meet those needs. But now we have an opportunity to make what I call a real lick at these services to these underserved communities, sometimes unserved, and even our neglected communities. So, excuse me. So we're just looking forward to your participation. Today, the purpose of today's webinar is to make sure you can get all of your questions answered. This is a program that, on the one hand, there's some ease of applying, but then it has some very technical aspects to making sure we get this right. And so we're here to answer those questions. And again, thank you for your participation. The County Commission, Commissioners Hudson and Commissioner Dewitt, we're all counting on you to help us get this right for Mobile County. Thank you so much.
Thank you, Commissioner. My name is Ashley Swain, and I'm a Director in Government Services with Horn. And I'm going to spend some time today talking with you about the American Rescue Plan Act, and in particular, the State and Local Fiscal Recovery Fund arm of the American Rescue Plan that allowed Mobile County to receive these funds directly from U.S. Treasury and then offer them out to the community to apply for use of those funds for eligible projects. So my goal today is to give you a high-level overview of how the funds ultimately got to Mobile County and what they can be used for, because ultimately we want to make sure, as Commissioner said, that they're used for generational type impact changes to the community that will last generations. This is a once-in-a-lifetime funding stream, and the odds of us seeing it again in our lifetime are very slim. And so we want to make sure we make those generational changes, and we also want to make sure we do those in compliance with Treasury's guidelines on what they can be spent on. And so I'm going to walk through that process, and then I'm going to turn it over to my colleague, Luke McAlpin, who's going to walk through how you actually submit a proposal and that process. If you have questions throughout this presentation, we encourage you to type those into the Q&A box. We have several team members in the background that will be answering those. We'll also take some to the extent we have time at the end live. If we don't get to all your questions, don't worry. We will issue frequently asked questions on the landing page. Just to let everyone know, a recording of this presentation will be available on Mobile's landing page, as well as these slides. So you don't have to write everything down. They'll all be posted on the website and available for you to go back and listen and review at any time and share those with your colleagues. So to get us started, let's talk about the American Rescue Plan Act. President Biden signed this into law in March, and to date, it's the largest economic recovery plan in U.S. history, totaling $1.9 trillion in COVID-related relief funding. And we'll talk about that relatedness nexus test that's going to need to be shown for eligible expenses in a moment. If you worked under the CARES Act or the Coronavirus Relief Fund in 2020, there was a strong focus in that prior COVID-19 funding on the public health crisis that we were facing, less on the economic crisis. Well, the American Rescue Plan has sought to both deal with the public health aspect, but also the economic disruption that was caused by the shutdown, as well as providing equity-based services and equitable outcomes to socially disadvantaged populations. So you've got a much broader uses here that are allowed under the American Rescue Plan that were allowed under CARES Act funding. If you worked under CARES Act, you may have known that there you had to show your expenses were in fact necessary due to COVID. So it was really a stringent but for, you wouldn't have incurred these expenses but for the pandemic. That's not the case under the American Rescue Plan. Rather, what you're going to be required to show in these proposals that our team will be evaluating for eligibility is your expense in some way related to the pandemic? Was it exacerbated by the pandemic? Was it caused by the pandemic? Was it just related to in general? So remember that relatedness nexus test, and we'll break that down by the eligibility categories in just a moment. Again, there's a strong focus on the economic recovery that's necessary after the pandemic, as well as providing equity-based services. The runway to spend these funds is you can have cost incurred starting March 3rd of 2021. So no cost prior to March 3rd of 2021. And you can obligate those funds between March 3rd of 2021 and the end of December of 2024. Now, what does that mean to obligate the funds? That means there's a contract in place for the services to be performed. So if this is a construction-based project, for example, to add bed capacity to a local hospital would be an example. Well, as long as you have a contract in place for those services to add to the hospital by the end of December of 2024, then that time period is okay. But you have until the end of 2026 to actually render completion of performance of that project. So just keep that in mind, that caveat there, that it's for costs starting March 3rd of 2021 through December of 2024, but you have until the end of 2026 to complete performance. And that's why we really want people to be thoughtful about the types of changes you can really make with this once in a lifetime funding, because we have a lot longer runway here. So let's talk about the state and local fiscal recovery fund. That is the arm of the American Rescue Plan that actually funneled money to states and local governments. This is just a visual representation of how the money ultimately got to the state of Alabama and to the county of Mobile. So you will see all of the counties, metro and non-metro cities, as well as the state, are all direct recipients of these funds from Treasury, which means they are obligated to spend those funds compliantly and ultimately responsible if they are not spent compliantly. This just gives you an idea of the once in a lifetime funding that Commissioner represented, over $350 billion provided to states and local governments. So really an opportunity here to make long-term changes. Now let's talk about what's probably most important to you. What can you spend the funds on? Supporting public health response, addressing negative economic impacts, infrastructure, but I want to stress this is infrastructure limited to water, sewer, and broadband. It's not your traditional roads and bridges infrastructure. That will come later in the proposed infrastructure bill that's pending right now in Congress, but this is limited to water, sewer, and broadband infrastructure improvements. Premium pay for essential workers, replacing public sector revenue loss, and providing equitable based services. So those are your categories of eligibility, and we'll break each of those down. To qualify under the public health response, if you have an expense that would qualify under this category of expenses, you would need to identify a need or negative impact of the COVID-19 pandemic, and then identify in your proposal how what you want to spend the funds on is positively addressing that negative impact or need caused by the pandemic. It can be directly caused by, it can be exacerbated by, it can be related to. Let me give you an example. Behavioral health, such as mental health and substance abuse issues, are allowed expenses under the American Rescue Plan. So if you submit a proposal, for example, to increase counseling services available in the mental health arena, you would just need to address in your proposal how the pandemic exacerbated or shed light on the mental health crisis in America, and in particular your community, and then address how you are proposing to spend these funds to move the needle in a positive direction to impact that negative harm caused or exacerbated by the pandemic. I like to give real life examples of what you can spend these funds on. So COVID-19 mitigation and containment, actual medical expenses to address public health needs, such as bed capacity, PPE, additional data systems for hospitals to be able to better track their patients and treat their patients, behavioral health, substance abuse issues, alcoholism, mental health services. Those are all going to be allowed. Again, you just have to show that nexus. How is it related to COVID? And how are you trying to move the needle in the positive direction? The more data and statistics you can show in your proposal of how your community has been impacted in these ways, the better, to really identify that negative harm caused by the pandemic or related to the pandemic will be helpful. Public health and safety staff is also allowed. More examples are responding to COVID-19 variants, increasing bed capacity, healthcare capacity, data systems for hospitals, supporting vulnerable populations. In the past, we've seen some in other jurisdictions, for example, with Alzheimer's and dementia patients, and how COVID really impacted them in a different way because of their need for specialized care and their inability to get that care because of the social distancing requirements and things like that. So submitting a proposal, for example, to assist those vulnerable populations and demonstrating, one, how they were vulnerable as a result of the pandemic, and two, how you're trying to move the needle in the positive direction to treat that vulnerable patient population. Congregate living facilities, ventilation, enforcement of public health orders, child welfare and foster family situations, and behavioral health programs. These are not the full list. These are just an example to get your mind going on what you could spend in the public health arena. Second area where you can spend funds is the economic response. So there you have to show a negative impact or harmful consequence of the economic disruption from the pandemic. So you'll need to show in your proposal that the group you're trying to serve was somehow negatively impacted in an economic sense by the shutdown of the pandemic. An example could be small business grants and a grant program for small businesses. Well, you would need to articulate in your proposal the types of small businesses you want to serve and how you're going to make sure that when they apply, they have to demonstrate that negative impact due to the economic shutdown. And then two, show how your program is going to, again, move the needle in a positive direction to respond to that harmful consequence. Some examples of allowable economic recovery programs would be assistance to workers, families, homelessness assistance, grants, forgivable loans, nonprofits assistance, small business assistance, workforce development. We know our workforce has been greatly impacted. That would be allowed. Again, you'd need to show how that workforce was particularly impacted and how your program is seeking to bring it back online. If you are seeking to spend funds on tourism, travel, or hospitality, those industries have been presumed by U.S. Treasury to have been negatively impacted by the COVID pandemic. So you would want to articulate in your proposal that you're trying to assist those particular industries of tourism, travel, or hospitality. And then again, how are you trying to assist them in a positive direction? Infrastructure, again, limited to water, sewer, and broadband. With respect to water and sewer, the funds that are allowed to be spent must either be in line with the Clean Water State Revolving Fund or the Drinking Water State Revolving Fund. Some examples here are improving wastewater treatment plants, infrastructure to severe weather events, green infrastructure, protecting water bodies from pollution, things like that. So just keep in mind, it's got to relate to the Clean Water State Revolving Fund or the Drinking Water State Revolving Fund articulated by the EPA. So if you have a water or sewer project, you need to make sure you articulate in your proposal how you are in line with either the Clean Water State Revolving Fund or the Drinking Water. Some examples again are improving drinking water treatment, water distribution, water supply, water storage. So just keep that in mind and make sure you articulate how you're in line with those in your proposal. Broadband is also allowed, so infrastructure related to broadband improvements. The key there is that what's going to be allowed is going to be serving communities, businesses, or individuals that do not currently have reliable internet. And so you will need to show in your proposal that you're serving a population that does not have reliable internet. Congress has deemed that to be a 25 download, 3 upload, and you'll have to show that you're ultimately going to be able to render them reliable internet if feasible of 100/100. So just remember there, the key is serving a population that does not have reliable internet and you're able to get them reliable internet. Equity-based services. I want to spend a little time talking about this. So if you have an expense and you're like, well, it doesn't really fit in public health, doesn't fit in economic, but it is tied to the pandemic. How can I try to get that in? Let's consider an equitable based services argument. If you are trying to serve a population that is in a qualified census tract, or if not in a qualified census tract, but you can show we're disproportionately impacted by the pandemic, then those activities are going to be allowed under the American Rescue Plan. It really opens up what you can do for those communities. So again, in your proposal, you'll want to articulate if you're trying to serve a qualified census tract area, and that's published on the HUD's website, or if you're not able to show qualified census tract, that you can show with data that they were disproportionately impacted by the virus. Now, what do I mean by that? That doesn't mean they have to have necessarily had more cases of COVID in that area. It can be that COVID shed light on inequities in that community, meaning their ability to access education, to work remotely, to access healthcare in general. If that was shed some light on from the pandemic, then they were a disproportionately impacted population. You would want to articulate that in your proposal, and then you're allowed to do a lot more things than you could if they weren't a disproportionately impacted population. An example would be providing an after-school program to bridge the learning gap that was caused by remote learning. Well, that wouldn't be allowed for just any community, but if it would be allowed for a community that was disproportionately impacted with respect to education and their access to equal education. Same with health disparities, education disparities, housing disparities, and overall childhood healthy environment. So just keep that in mind. You got a lot broader things you can do with these funds if you are in fact serving a qualified census tract or an area that was disproportionately impacted by the pandemic. Premium pay for essential workers. This is different than what was under CARES Act. So you can no longer presume that public health and safety workers are dedicated to COVID. Rather, you can pay premium pay for essential workers. And essential workers aren't just public health and safety. They're anyone that couldn't do their job remotely and had to be public facing in the pandemic, irrespective of the fact that there was a pandemic going on. So they had to be public facing. That's restaurant workers, grocery store workers, transit workers, our truck drivers, all of those people. You would need to articulate who you're defining as essential workers and how you're going to compensate them for that time. The only qualifier is they cannot exceed more than an additional $13 an hour or $25,000 a worker in total. What can't you spend the funds on? So even if it falls in one of those buckets, what has Treasury said? No. Net reduction in tax revenue. You can't reduce your taxes and your tax obligation, but then overall say you lost revenue. You can't make deposits into pension funds, fund debt service, legal settlements or judgments, or make deposits to rainy day funds or financial reserves. And the reason for that is this is once in a lifetime funding that should be used for one-time purchases to make generational impacts. And so we really want you to keep that in mind. I want to talk a little bit about the reporting requirements, because as you send in these proposals, one thing we're going to be thinking about is, are you going to be able to show the documentation necessary that ultimately Mobile County has to show back to U.S. Treasury to keep in compliance? This is just to give you an idea. I'm not going to go through it in great detail, but of all the reporting requirements, every 3 months, we have to issue reports on what our projects and expenditures are and detailed data to that extent. So that's why we're going to require narratives of the projects that we fund with these dollars. We're going to require proof of purchase, detailed documentation that if your project is ultimately approved, we will work with you on to make sure you're able to maintain a system of record and documentation so that ultimately the county can comply with its obligations and these funds are not clawed back. Talk a little bit about the process, and then I'll turn it over to Luke to go through the actual application. But you're going to submit these proposals through the system, and he'll talk about that process of submitting the proposals. And what we're going to do is look at those proposals. They have to all be using this approved template that's provided. And we're going to perform risk assessments. So they're going to be a multi-level review process to make sure that those articulated uses are actually in line with those eligibility categories I went through. So those will be done on the back end. We'll make sure that all of the funds are actually being expended on things that are eligible. And so eligibility will be assessed first before funding decisions can be made. So just wanted to let y'all know that. A risk assessment is going to detail the expenditure category that you fall under. If you meet that test, sometimes there's going to be some back and forth and you'll be contacted to say, we need some more information on this. We feel like it could fall into the economic impact category, but we need a little bit more information. So just know there may be a little bit of dialogue and back and forth with you. And that's what I have for today. I know that was a quick and dirty explanation, but just wanted to make sure that you had an overview of what you could actually spend these funds on before going in and working through the proposal itself. I'll be in the background answering questions written out if you have them, and then I'm going to turn it over to Luke to go through the actual proposal process.
Hey guys, my name is Luke McAlp and I'm a senior manager at Horn. If you're looking at my screen now, you'll see that I am on the Mobile County website where there's a link to the application that I am about to go through. It's 9 pages.
Luke, you're sharing your screen. Sorry to interrupt, but we don't see your screen.
Oh, sorry.
That's okay. Just making sure. There we go.
All right, good deal. Let me move this over. Okay, sorry about that. All right, I'm on the Mobile County website. There's a link that gives you access to the application that I'm going through right now. If you're filling out the application, I would definitely advise you to read through it before you started drafting it. The first page has your directions on how to submit the application, including the email address, if you're emailing your submission, or if you're mailing it provided. It also provides eligible use restrictions and instructions for the request. And now part 1, what I've done is filled out just a sample application. It's not real, and I don't work for St. Dominic's Medical Center. So it pretty much provides a way of filling out the application online simply by drafting, submitting. You can add any detailed information you want to provide. The first part is your name of your organization, point of contact. In this case, it would be me, address, phone number, email address. All right, the total number of requests is important. Each application that you're submitting needs a page filled out for this. And then below that, you have a short description of the project, what the project's goals are, how it's funded, etc. So the next question has, does a proposal request additional funding outside of Mobile County's fiscal recovery funds? In this case, I've checked yes, or written out yes. It has a breakout of the funds that you're requesting between fiscal years 22-23 to 24-25. This is just one-time money on my sample application, so I just put numbers in those first 2 blanks. Below that, if there's other funds that are being used to pay for the project that you're submitting, a brief description is needed on how to, where they came from. In my case, I borrowed money from a bank, so I drafted that in the box below that. Okay, the next section is under funding. What is the program initiative, resource the request would fund? In my case, I put in here 300 new emergency room beds, new personnel wing for emergency room employees, for meals and rest, additional space for families, for patients in the emergency room. The next question is, we answered it for you. You have to choose between 3 different answers. So in this case, this request is a change to renewal of an existing program, a new program initiative, a resource, to replace county funding or other funding for an existing program. In my sample, I've clicked the first box, which is a change or renewal to an existing program, because I've already borrowed money to pay for the project that I've submitted additional funding for. The next page we'll go to is question 3. It's a detail of what expenditure categories the requested funds would apply to corresponding approximate or estimated costs. You've got it in 4 different sections. You got personnel or premium pay, the equipment or contract services or other, in particular infrastructure, which would be my project. You click on that box and you put the total amount. And if it's other, in this case, it was for me, you would have to provide a brief description of that. The next question is the solution plan. Is the solution plan for a multi-year effort? In my case, it's no. So if you were if it was yes in your case, you would have to give a brief description of each year in which you would provide fund or need funding, and how it will impact the abilities to complete by fiscal year 26. Section 2 is the purpose of this section is to provide a challenge, a proposed expenditure, extend, resolve. So what it's doing, the first question on section 2 is, what is the issue or opportunity the request will address, and how it's related. In this case, with the increase of patients coming in with COVID, building new rooms at the emergency room at the said hospital, it would provide spacing for additional employees and patients when they're coming in. How does it, the next question is, how does this support the county's recovery for economic health and the overall effects of the COVID-19 pandemic? Of course, with COVID-19 pandemic, we had more people in hospitals. We're building more space, more access for patients coming in, so it wouldn't be as crowded and we can get to individuals quicker. The next section is in responding to above questions. I'm sorry, that section right there actually gives you assistance on the above questions. Number 6 is have previous attempts been made to remediate an issue or opportunity to discuss in question 5. In my case, that would be no. But if you've looked for other funding sources for the project you're submitting, you would have to explain what they were and whether or not you were successful in that area. And then section 3 is a statement of eligibility. The purpose of this section is to explain how your agency or entity will articulate the legal reasoning why the proposal is eligible for funding. And there's categories in this section. In number 7, you will get to choose between 4 categories and where your project falls under, and just check the box on that. In my case, it would be the support of public health expenditures. Number 8 is there we go. Sorry, having trouble with my mouse. The corresponding text on number 8 is above, from the question above, and it's an explanation of how the issue or opportunity has worsened or emerged in the light of COVID-19. Like I said earlier, in my case, it would be because of an increase of patients due to the virus spreading like it did. So you would provide that information there. Page 7, question 2, a description of how the proposal solves the negative impact. More space, more rooms, etc. in my situation. And then the next question is, identify the key activities, inputs, the program as well, and short-term results, outcomes of the programs. Again, that's providing additional rooms, in my case, for patients in a timely manner to see patients quicker. And then section 4 is other questions. And the purpose of this section would be to understand where departments work together and how they serve similar individuals and groups. So in my case, it says, does this solution have an impact on other departments or agencies? It could, but I put no, but I could have put yes. And if so, yes, please. So please indicate a program below. So I could have checked yes to that. In the next section, I could have put first responders, EMA, ambulances, et cetera, having quicker access to the hospitals and it's not backed up because we provided more room in the emergency rooms. And then question 10, does this solution impact any individuals, groups, or individuals locally or countywide? And in my case, I clicked 3 of the 4 because it provides better healthcare to constituents or citizens of Mobile County, groups and stakeholders. Page 8, I didn't click other, but if it was other, who else would it provide help to? You could give a description there. Section 5 is management administration. The purpose of this section was to understand the feasibility and management proposed staffing models. So question 11 on that in section 5 is please list the staff that would be responsible for administrating this project. In my case, it would be the hospital administration, construction team, CEO, chiefs of staff, et cetera, and what their roles would be in the project that's being proposed. Number 12 is, do you anticipate the need for additional services or external third parties, nonprofits, otherwise to successfully execute this project? In my case, that would be no, but if you see in your proposal the need for additional funding or other sources or agencies being involved, you would, of course, check yes, write yes, and then give a description to that there. And then the last section would be your evidence of impact. And the purpose of this section is to understand the evidence and research the program is based upon to provide a context basis of the program. So what are your goals, the outcomes? Capacity increase would be my, I'm providing 400 new rooms, providing new space for employees that are working at the hospital. And once you've filled this out, you can give feedback there. You go back up to the page, and like I said earlier, you can, on page 1, you can see that you will print that out, and for each submission, again, you have to have this page filled out, but you can combine them in the email or in one packet that you can mail to Mobile County Department of Affairs. And that's pretty much it. So I'm going to pass it to Jimmy, I believe. I'm not sure who's next.
Thanks, Luke. We've had several questions come up and we've answered those in the background, but I wanted to take some of them. I just answered one that I thought would be helpful. There was a good question about how do you show water and sewer projects are related to COVID? That is the one category you don't have to show a relatedness to COVID standard. Rather, you have to show your project aligns with either the clean water revolving fund or the drinking water fund. So that one you don't have to show a tie to COVID. It's just that what you're trying to do aligns with one of those EPA regulations. So it's got to be either with clean water or the drinking water side. So that's a great question. Not a related to COVID standpoint there, but for every other category, there's going to be a COVID tie. Many of you have asked if you could submit more than one application. Yes, as Luke stated, you can submit more than one. You just need to state in your application to that question what number this is so that we can track how many you've submitted and we can understand that. There was also a question about what can I apply to both the city and the county? You can, just remember there can't be a duplication of benefits. So if the county ultimately funds your project and then the city says they'll fund it too, you can't receive both funds, obviously. Now you could receive a combination of funds if you wanted to apply for 20% from the county and another percentage from the city, however you want to do that, that's fine, but we just can't have a crossover and duplication of benefits paying for the same services at that point. The application itself is located on the landing page, and we've posted a link to that in the questions answered section. So you're able to print that off, look through it, take your time with it. Also, these slides will be on there and the recording. Let's see, any other question? Timothy, you want to take some?
Yeah, I was just going to address a little bit off of what you were talking about, Ashley. And good morning, guys. We really appreciate you joining us. We're really excited about working with Mobile County, and it's been a blessing for us, and seeing how well your county is run. And so I was going to also, in piggybacking off of the question about requests from the city and the county, that is permissible, but the math has to add up, right? And so and I also want to be remiss if I didn't state that should you be awarded funding as a result of your application, there will be subrecipient agreements that are set up in place. And so, and not to sound pejorative, but one of the things that the county will be required to do by U.S. Treasury is monitor and make sure that all those contracts are in compliance, that the money is being spent as it should, that if there are any match funds associated with what you are putting up relative to a particular project, that the math again adds up. And so we certainly have a fiduciary duty to the county and to U.S. Treasury. Ultimately, a lot of these funds will be audited, and so we want to make sure that everything is above board and done correctly. And I know that it will be, and we're not worried about that. But I would be remiss if I didn't say it. So appreciate you guys, and we are going to one of the questions. I don't know if Ashley touched on this or not, but there's been a question about a qualified census tract, and so we'll try to get a link to those areas within Mobile County to help you better assess what's going on. So anyway, I think that'll be good. Continue with your questions. I see that there are a few here below me as I talk, and so we do not have a limit, I don't believe, on our text box. And if you run into that, then certainly reach out, and we can develop other mechanisms, Ms. Melinda, for you to submit so that we get all of your information. There's a question about are the budget requests for their caps. There are not caps as we sit here today. Obviously, it's a finite amount of money. And so as a result of that, there will have to be some budgeting that takes place. And so while we don't have definitive caps, there will in a way be de facto caps, I guess. Who is the best contact? Well, I think there was a question. Looks like that was answered.
Yep, that's been posted. There's an email address that you can email with technical questions that you may have. It's in the answered questions and answers, but it's ARPA, ARPA.info@mobilecountyal.gov. ARPA.info@mobilecountyal.gov. And just to go back real quick, there was a question about the sample application. We'll get with the county to get posted the example, that one similar to what Luke went through, so that you have an idea of what you can type into. So we'll work on that just so you have an idea of the types of answers we'll be looking for.
And there's another question. What's the review and funding timeline? We are trying to review these as quickly as possible. We kind of have a soft proposal deadline of October the 25th. And that, again, that's not set in stone. The reason is that we're trying to get these things reviewed through our risk assessment process. And a part of that will be analysts likely reaching out to you for additional information, as the case may be, either via phone or via email. And so we try to expeditiously get through these things and work forward. It seems like, as we sit here today, with an obligation deadline at the end of 2024 and a end date for the entire program being the end of 2026. That's a long time, but as you guys know, particularly relative to infrastructure projects, water, sewer, and other things, when you throw in engineering, when you throw in sourcing materials, when you throw in the actual work to be completed, that's not that long of a timeline. And so for that reason, we're trying to review as many proposals as quickly as possible, as thoroughly as possible, for the program, so that we do not run afoul of those deadlines that are in front of us.
Timothy, this is just want to make the point that October 25th date is really not a deadline, but it is that priority consideration that will be received. So just want to make sure we're clear on that. It's a date. We're trying to give priority, as Timothy mentioned, to review those so we can start gathering projects and seeing what is available for the commissioners to review. They will continue to come in thereafter, but that's a priority consideration.
That's correct. Let's see, maybe one more question. When will the awards be announced? That is dependent on the proposals that we receive and in our risk assessment process, and also the approval at the county level. And so that's a question that I can't answer with a definitive date as we sit here today, because with the proposals that are coming in that we're seeing, again, sometimes we need additional information. And so in theory, we could have proposals that are approved in the next few weeks. And I think that will likely be the case. And they will continue to roll forward as we move into time.
I want to bring up a quick qualifier. There's some questions about infrastructure, like building of a new fire station or hospital facility, things like that. Those don't fall under your infrastructure arm. So you would need to meet the public health test to see if those would be allowed. Because again, the only infrastructure allowed is water and sewer. That doesn't mean you can't do other things like add an aftercare school facility or something like that, but it's got to fall within the public health, the economic, or the equitable based services test to get that qualified. So make sure you're looking back at those slides on those tests and seeing which category you could fall under. There's a question about suggestions for Mobile County volunteer fire departments that respond to calls. So if you need to help with response time and things like that, if you can show statistics in your proposal how calls increased during the pandemic and the demand increased and the need for certain expenditures to be incurred so that you can respond better to those calls, that would fall under the public health test. Also, it could fall under equitable based services if you're serving a community that doesn't have access to healthcare and their ability to get to the response time to get to a hospital, for example. If you can show they don't have the access to that and you need a certain expenditure like radios or things like that to increase your response time, again, show those statistics in your proposal about how that's related to COVID, how COVID really exacerbated or exposed that lack of ability to respond timely, and then how this expenditure would help that need. I think those are all the questions we have for now. We'll give it another minute and see if we get any more in, but just know this this recording will be posted so you can go back and listen, and also the slides will be. Timothy, I don't know if you want to speak to this, but can the funds from the county be used? Well, they have to be used in the county and not the city. I know these need to be geared at efforts to assist the county, but I don't know if you want to speak to that.
Yeah, and they could be used in the city as well. The city of Mobile will receive their own allocation, but that does not mean that the expenditure of these funds cannot be used in the city as well. And so, as a matter of fact, it could be a collaborative effort between the city and the county potentially. And again, that goes back to what Ashley said earlier, and the math has to add up. And so one of the big things that you see nationally that auditors look at is a duplication of benefits, which basically means that you get the same funding from different sources that would be the equivalent of over 100% funding for a given project. And so that's a big no-no, as you might imagine. And so we have to be very particular about that. And so it has to be very well documented throughout the process. But these funds can be used in the city of Mobile as well.
So salaries and payroll is going to be it's a much trickier standard there, but you're allowed to pay essential workers premium pay. So that means pay on top of their base pay for essential work during the pandemic. So that's what's allowed here. Think about it like this. This is one-time funding that should be used for generational type changes. So salaries, this is one-time funding. You're not gonna be able to fund long-term salaries with this type of money. It's the purpose behind that with respect to paying individuals is going to either be to pay essential workers above and beyond their base pay for their work, and defining them as essential workers, or you can also, under the administrative cost, if you need to hire someone to help administer a program that's using these ARPA dollars, that would be allowed. But salaries long-term are not going to be.
I mean, we anticipate, along the same lines that Ashley's talking about, we anticipate there being pretty strict scrutiny as to what is considered an essential worker in this context. And so I would caution you, there's stories from around the country of kind of mass bonuses and things like that for all government employees. That is going to be, in all likelihood, an impermissible use of these funds. And so you have to be very measured and, again, document that this is an essential worker and why they're essential worker. And essential workers in this context are those that are dealing directly with the pandemic. And so, anyway, certainly not to discourage you from looking at those routes of compensation for individuals, but there is a heightened degree of scrutiny associated with that.
One last thing I'll talk about is workforce development. If you can show that workforce development is needed because COVID showed a need to develop that workforce, so CDL drivers and the need for transit workers, things like that, yes, you can show again, you got to show statistics and a need to grow that workforce development, and then show how your program would in fact do that. Dana, did you want to comment?
Yeah, I have just want to point out that with this program, please be advised that it is a federal program. So when you're applying for funds, make sure you have the capacity to manage a federal grant program. That's very important. You will have monitoring by Horn. For those of you that are current partners with Mobile County, you know what our appropriation process is like. You know what our appropriation contract is like. Just imagine the appropriation contract on steroids. So we want to make sure that you have the capacity. You know, we don't get any pleasure out of you not being successful. We definitely don't want you to have any findings. We don't want you to misappropriate funds. We do not benefit from that. But please, I want to stress that you have the capacity to manage a federal grant program, because under the compliance supplement, this is considered a high-risk program. That means that it's automatically a major program. For those that know the grantees, you know what I'm talking about. So just please make sure, I know the money is out there, but we definitely want you to be able to manage it. Make sure you have sufficient staff that can keep accurate records, keep accurate accounting. And so that's, from my perspective and Horn's perspective, also in their due diligence in looking at applications, they're also looking at the entities. They'll be looking at what you filed for your 990, and they're going to be verifying that you're a nonprofit. You know, they're going to be, you know, going to your website and make sure you exist. And so we just want to keep that in mind. And, you know, we want to do good work. I know the question came up about salaries. One thing we want to understand, as Commissioner Lovegood said, this is generational funding. And so, yes, salaries may be allowable, but it's only for premium pay. And it's not for you to go back and reimburse yourself for expenditures that have already been made. You would have to definitely show that you pass these funds on to your staff. So I just want to clarify that. And just, thank you so much for taking your time. And we really appreciate the good work that you do, and for all our partners and all those that we currently have and those that we plan on having in the future. Thank you so much for attending this webinar and stepping up and coming to the table to get information. And that's all.
All right, we've got a couple more questions. I don't believe there's a maximum funding amount, but just remember there is only a finite amount of funding available, and there'll be multiple projects funded. So just keep that in mind. Back to the city county question, and Timothy, correct me if I'm wrong, but it's not you can only use these in the county versus the city. It's just a duplication of benefits issue. So we just have to make sure if you're receiving funds from another source, that those aren't crossing over and paying for the same services. But as long as we're benefiting Mobile County in general, it's okay if those activities take place in the city.
That's correct.
Well, we truly appreciate y'all's time today. Again, this will all be posted. And if you have any questions, that email address also for support will be posted on the landing page. And we look forward to working with all of you on this effort and making generational type changes in Mobile County.
Thank you, guys.
I believe that concludes our presentation today. Thank you again for your participation. Have a great day.